I found that nothing in life is worthwhile unless you take risks. Nothing. Nelson Mandela said, "There is no passion to be found playing small and settling for a life that's less than the one you're capable of living."
Is knee pain stopping you from running or lifting? What if I told you you can still stay active even if you're uncomfortable? So if you're trying to run, walk, lift, whatever it may be, you're gonna wanna stick around to learn exactly how you can still run and lift weights even if you may have some knee discomfort. Hi, I'm Dr. Matt Bradbury, family corrective chiropractor here in Georgetown, Ontario, Canada. And this is our practice, One Life Family Chiropractic. So if you're suffering from knee pain and you're trying to do what you love, because I know myself as a busy parent, there's just some simple things that I love to do every week, whether that's my walks, running, lifting, and those are really things that help manage my day. And so when you can't do what you love, it's frustrating. I know, I get it. So I want to teach you some things today, some workarounds that I've used successfully, especially if you're suffering from some knee pain, some simple things that you can do. And I want you to remember that everything is connected. So in terms of how your top, mid, bottom, it's all connected. And sure, we're going to talk about the knee today, and I'm going to share with you how you can help yourself and get into a session, whether it's walking, running, or lifting, and some potential workarounds. But I also want you to remember that, sure, often your knee flexes, extends, and often your hip doesn't have the range of motion or may not be functioning as well as it could. Your pelvis, your SI joints, your lumbar spine, and a lot of times above and below the knee is where the actual problem may be. So I want you to consider addressing some areas above the knee today and some simple things you can do at home. I want you to remember though that as a corrective chiropractor, I'm looking at the whole picture, especially you remember what controls your body, your nerves, which start in your brain, send messages through your nervous system. So your central nervous system talks to your muscles, your organs, all the important things that helps with how you heal. So if the nerves are irritated, that's one thing that we look for. It's the main thing that we look for as corrective chiropractors here in the office. And if those nerves are irritated, some of the areas you may feel, some of the areas you may have no idea about, but they control how you function. That's why it's so important to get tested to know what's going on and how all these nerves are communicating, because that better brain-body connection is going to help with your joint awareness, how you move, how you fire those muscles, and how you heal. So especially with how all the nerves get to here and travel to your knees, your gait, it's all going to be connected and vitally important to helping you thrive, be more resilient, and function at your best. So we're going to talk about what may be causing your knee pain today. Well, guess what? Muscle imbalances, improper form, if you're sloppy with your form and how you move, and just overuse. And that's why I'd say it's so important to change things up, add some variation so that you don't create necessarily those overuse injuries. So today what we're going to specifically talk about is these are your glutes, your small hip rotator muscles all through here that connect all the way down to your knee. Now I want to give you some tips on how you can proactively strengthen these things. Because I know myself, if my knee's starting to bug me, I've probably stopped putting in the proactive work for my hip, which all those small muscles are going to help with the motor control and how you move. So if I've stopped putting in the work, oftentimes I'll be saying, oh, yeah, my knee is kind of nagging, it's sore. So I want you to consider these simple things today. I'm going to teach you some simple exercises, effective glute bridges of course, some sideline work with some core work, because your core, your planks, and as well as your hips are going to be all connected with getting to your knee. And of course, talking some foam rolling to help desensitize the tissues and help you loosen up and move better. Now, the first thing I want you to start focusing on is strengthening your posterior chain muscles. Your glutes, your small hip rotators. I want you to start by lying on your back, just like this. So you're gonna lie down just like this, and this is gonna be your proactive work that either you do every day for a couple minutes at night, or you do before you go and run even. This would be great if you did it before your run to help focus on being proactive. So what you're gonna do is just like this. Feet about hip width apart, come up, pause, back down, pause. You're gonna work in that 12 to 15 rep range for 2 to 3 sets. And if you wanna advance it even further, guess what? You can do the single leg variation. Just like this. Pay close attention. Don't let your knee drop in when you're doing either of these variations. Just like this, drop down, bring yourself up, pause. And again, working in that 12 to 15 rep range, which you're going to train them slightly higher reps to help give them some more capacity so you can be more resilient if you're trying to get out there, run, lift, whatever it may be. Number 2, well, guess what? This one I absolutely love. And you're going to do it from the side plank position because your small hip rotators are just so important to help protecting you if you're trying to run, protecting your knee, or you're trying to lift, especially if you're trying to squat and lunge. These are going to be some amazing warm-up exercises. I use them pretty much all of my workouts. If I'm going to train lower body or do full body Olympic lifting, these are some simple movements that you can do. So what you're going to do is start like this, side plank position, and what you're going to do is just come up, squeeze, and back down. Up, squeeze. Now I'm also going to add a little clamshell in there. So I'm going to open up, separate my knees, and back down. This one, you're going to work in that 12 to 15 rep range again. And as you progress this, guess what? You're going to be coming up just like this. You're going to be coming up and back down. Up and back down. Now, with a longer lever, you may be working in the 8 to 10 rep range, but 2 to 3 sets. And really, you're working on those small muscles which are going to be vitally important to protecting you and getting you out there doing what you love for your own fun time. The final thing I want to show you is just make sure you invest in your foam roller. Really simple, easy. You'll notice I have actually a 3-inch PVC pipe with some hockey tape around it. A little more of an aggressive version. I like this version personally, but what you're going to do is just, you're going to lay on your stomach and you're going to work out, guess what? Not necessarily the thick muscle belly area, but where it becomes the muscle tendon and goes into the joint. So you're going to work more around this area, and you can work on the sides, you can work on the teardrop on the inside, but it looks something like this. So I'll work on the outside just like this. And you may find it really uncomfortable, so breathe longer out. 4 seconds out, 2 seconds in. You can flex and extend your knee. You can change the amount of weight you put down. So you can lift up a little bit, you can put more weight down. But I'll work on the outside as well. I'll work on the top, and then I'll even work on the inside. So you can work all front of that quad, loosening it up. And really, you're going to work into a position, you're probably going to be 60 to 90 seconds at least on each leg, but you're probably going to work more in the sense of, does it get a little easier or a little less sensitive? And then what I want you to do is get up after you do these exercises, do some squats, move around, and just see how you move in terms of keeping your knees out when you squat. Can I run a little more with ease? So a lot of the times you loosen up, you activate the right muscles, and things get simpler and easier. And now just because maybe you have left-sided knee pain doesn't mean you should neglect the right side. Make sure you do your foam rolling on the right side as well, do your exercises for the right side as well to help strengthen both sides. Clear up any potential muscle imbalances and help you move better and do what you love. Now, some other things to consider when it comes to your knee pain and doing what you love is, of course, make sure you may want to create some relative rest in there. So what I've done in the past is done less total weight, less sets, less reps, less volume overall, giving yourself a bit of a dip like this, still being able to move and do what you love, but changing the intensity. Because you give yourself that slight break, and oftentimes you work on those muscle imbalances, those stiff tissues. Oftentimes it gives you a little bit of a oomph to get back on track. So consider that. I mean, of course, oftentimes, in terms of the secret ingredient, in terms of performance with busy parents, I will share something myself that I'm a testament to is corrective chiropractic. I've included that in my life for 17, 18 plus years. And in terms of resilience and just the fine tuning between your spine, your nervous system, your central nervous system, so your body can operate at its best, it's all connected. So consider that. I'd be happy to find you a corrective chiropractor close to you. So some other neat things that I would consider is, well, first of all, change the running surfaces maybe a bit of a softer surface for a time. Maybe renew your footwear. Because 300 miles, let's say 400 miles, your shoes start to wear out and compress to the point that they're not as effective anymore in terms of how you move, your gait, and conditioning. So consider that. The surfaces, change the environment, and just maybe jump on the bike for a bit, right? If you're usually 3 runs a week, jump on the bike one time to give yourself a bit of a break, still help improve your cardiovascular health, but change what you're doing. Of course, with the lifting part, make sure squatting, your knees aren't caving in, and your mechanics are great, right? Oftentimes that means lightening up the load to keep your mechanics really good so that you're in optimal form when you're lifting, squatting, lunging, whatever the fun part you may be doing. So anyways, thanks so much for tuning in today. I had fun sharing this one with you. And this is really important. And remember, a lot of times you're doing this proactive work. Here's the secret as well. You're doing this proactive work before necessarily you feel the discomfort or the pain. Because if you work on those small things, those are the things that often break down in terms of muscle imbalances and create overuse injuries. So focus on those simple things, okay? I know you're strong. Anyways, remember, you're far stronger, more resilient, and resourceful than you may have been led to believe. And I love sharing this message. So my only ask is I got a big mission in terms of helping people understand their health when it comes to their spine and their central nervous system. And they got to be proactive and help themselves function better. I can't do it alone. So please take a moment, subscribe to our channel here, like it, share this so that someone else can get the benefit. And I really, really appreciate it. And I appreciate you. Talk to you soon. Bye for now.